that is small intestinal bacterial overgrowth, or in short, you can say SIBO. So, in this video, I'm going to talk about the homeopathic treatment along with the best homeopathic medicines that has been used for the treatment of SIBO, that is small intestinal bacterial overgrowth. So if you are suffering from SIBO, then this video is definitely for you. So watch this video till end for more knowledge and stay connected with us for more informative videos like this. So let's understand what exactly is the meaning of SIBO. So small intestinal bacterial overgrowth occurs when there is an abnormal increase in the overall bacterial population in the small intestine, and particularly types of bacteria not commonly found in that part of the digestive tract. This condition is sometimes called blind loop syndrome. SIBO commonly results when a circumstance such as surgery or disease slows the passage of food and waste product in the digestive tract and creating a breeding ground for bacteria. The excess bacteria often cause diarrhea and may cause weight loss and malnutrition. So this is the exact meaning of SIBO, small intestinal bacterial overgrowth. I hope this is very much clear to you guys. Now next we'll talk about why small intestinal bacterial overgrowth develops. Okay, so let's talk about the pathophysiology. The small intestine is the longest section of our digestive tract, measuring about 20 feet, that is 6.1 meters. The small intestine is where food mixes with the digestive juices and nutrients and are absorbed into your bloodstream. So, unlike your large intestine, that is colon, your small intestine normally has relatively few bacteria due to rapid flow of the contents and the presence of bile. But in SIBO, stagnant food in the bypass small intestine become an ideal breeding ground for the bacteria. The bacteria may produce toxins as well as interfere with the absorption of the nutrients, and the breakdown products following bacterial digestion of the food can also trigger diarrhea. Now, next we'll talk about the clinical feature, that is what are the symptoms and signs of SIBO. So, first and the foremost symptom and sign that you can observe is loss of appetite, abdominal pain, nausea, bloating, diarrhea, an uncomfortable feeling of the fullness after eating, unintentional weight loss, and malnutrition. So, when to see a doctor? So, bloating, nausea, and diarrhea are the signs and symptoms of many intestinal problems. So, see your doctor for a full evaluation, especially if you had abdominal surgery and if you have persistent diarrhea, rapid unintentional weight loss, abdominal pain which is lasting more than a few days. And if you have severe abdominal pain, seek immediate medical care. Okay. Now, next, we'll talk about the potential causes which are responsible for SIBO, that is, small intestinal bacterial overgrowth. So, first and the foremost cause is complications of the abdominal surgery. Second cause is structural problems in and around your small intestine. Third cause is certain medical conditions such as Crohn's disease, radiation enteritis, scleroderma, celiac disease, diabetes. Next cause is So these are some potential causes which are responsible for SIBO. Now next we'll talk about the risk factors. So factors that increase your risk for SIBO are: first, gastric surgery for obesity or ulcers, a structural defect in the small intestine, an injury to the small intestine. Next is an abnormal passageway, that is fistula, between two segments of the bowel. Next is Crohn's disease, intestinal lymphoma, scleroderma involving the small intestine, diabetes, history of radiation therapy to the abdomen, diverticulosis of the small intestine, adhesions caused by previous abdominal surgery. So these are the risk factors. Now next we'll talk about the complications. Small intestinal bacterial overgrowth can cause escalating problems, including: first, poor absorption of the fats, carbohydrates, and proteins. Second, vitamin deficiency. Next complication is weakened bone, that is osteoporosis. And last is kidney diseases. So, in order to get rid of all these problems, now I would like to discuss about the treatment. So, what is the ultimate treatment for SIBO? So, yes, we are talking about the homeopathic treatment. Now, we'll discuss about the homeopathic medicines which has been used for the treatment of SIBO. Let's talk about the homeopathic treatment. So, homeopathic medicines for treating SIBO are all prepared from naturally occurring substances, and they treat the condition in safe, gentle manner without any side effects. The medicines are chosen on the basis of individual symptoms presented by the patients and used as per their different symptomatic indications. The first and the foremost medicine that you can see here on the screen for SIBO is China officinalis. So, China is a highly effective homeopathic medicine used to treat excessive abdominal gas in cases of SIBO. The gas in the stomach stays for a longer time after eating. Bloating occurs in the entire abdominal area and it gets better with motion. Colic from gas in the stomach, bitter belching, sour vomiting, diarrhea, and weakness. Fatigue may also occur. And worsening of the gastric symptoms following consumption of foodstuffs like fruit, milk, fish, beer also indicate the use of China. Next homeopathic medicine for SIBO is Lycopodium clavatum. So, Lycopodium is a very wonderful homeopathic medicine used to treat abdominal bloating in case of SIBO. The person needing this medicine complains of distension of the abdomen soon after eating. Eating even a small quantity of food can lead to bloating. The abdomen gets tense with a bursting sensation. The flatus may remain obstructed, causing abdomen pain, diarrhea, and constipation may alternate. And excessive bloating may occur from the consumption of food like onion, cabbage, and beans. Now, third medicine for SIBO is Aloe. So, Aloe is a very useful homeopathic medicine for treating diarrhea in cases of SIBO. The chief features to use aloe are copious, watery stool, jelly-like mucus that is passed with a loose stool. A sudden urgency to pass stool, a constant bearing down pain in the rectum, heaviness, bloatedness, and excessive flatus in the abdomen, along with a rumbling or gurgling noises. Now, next homeopathic medicine for SIBO is colocynthis. So, it is a very suitable homeopathic medicine for treating abdomen pain in cases of SIBO. The abdomen pains are cutting, tearing, cramping, and colicky. Eating or drinking anything tends to worsen the abdominal pain. In most cases, the pain is present around the navel, along with a burning sensation in the stomach. Hard pressure or bending double can relieve the abdominal pains. Next medicine, last but not the least, that is Ipecac. So, Ipecac is a very wonderful homeopathic medicine used to treat cases of SIBO where nausea and vomiting are the predominant symptoms. The nausea is intense and constant, making the person want to vomit. Nausea appears quickly after a bout of vomiting. A smell of food tends to worsen nausea, and vomitus is watery fluid or having food. The other accompanied symptoms include pressing pain in the stomach, loss of appetite, cutting, cramping pain in the abdomen. So these are some homeopathic medicines which has been used for the treatment of SIBO. So that's all. In conclusion, I want to say that homeopathy offers a holistic and individualized approach to managing symptoms and promoting digestive health. So, if you find this video informative and valuable, please give it a thumbs up and subscribe to our YouTube channel and hit the notification bell for more insights into the holistic health and homeopathy in the world of homeopathy. So, thank you so much for joining of the homeopathy for small intestinal bacterial overgrowth, that is SIBO. So, see you guys in the next video. Till then, stay safe and stay healthy. And if you are suffering from SIB or any other health illnesses, then you can contact us for online appointments on the screen. You can see how to contact us. So that's it for now. And thanks for watching this video.